Hello everyone and welcome to the OncoAlert Weekly Roundup. I'm your host, Gil Morgan. This week, the overarching theme in oncology is all about refinement and personalization. So let's dive right in. But before we do, reminding you that these are just some of our top picks, and for a more complete review, we invite you to subscribe to our newsletter at www.oncoalert360.com or through the QR or link in this post. That's www.oncoalert360.com. So first up, prostate and bladder cancers. The PRIME Diagnostic Trial looked at biparametric MRI versus multiparametric MRI for detecting clinically significant prostate cancer in biopsy-naive men. Among nearly 500 patients, biparametric MRI, which skips the gadolinium-enhanced sequence, was non-inferior to the standard multiparametric approach. Detection rates for clinically significant cancer were essentially identical, and scan quality was high. The take-home message is biparametric MRI is shorter, cheaper, and potentially scalable worldwide. A win for efficiency without sacrificing diagnostic accuracy. And switching gears to bladder cancer, there's exciting preclinical work in NECTIN4-directed CAR T cells. Researchers found that these engineered T cells were active even in enfortumab vedotin-resistant urothelial carcinoma. And here's the twist. NECTIN4 expression is regulated by a special pathway, meaning that drugs like rosiglitazone can upregulate the target and enhance CAR T activity. This opens doors for combinatorial strategies in patients with refractory disease. Meanwhile, an international consensus panel has defined standardized endpoints for bladder-sparing trials in muscle-invasive disease. Clinical complete response, combining pathology, cytology, and imaging, along with event-free survival as a primary endpoint, is now recommended. The goal is to harmonize trial design and advance organ-preserving strategies while centering patient preferences. Moving on to GI oncology and in pancreatic cancer, the PREOPANC-2 trial compared neoadjuvant FOLFIRINOX to gemcitabine-based chemoradiotherapy for resectable or borderline resectable disease. After a median 42-month follow-up, overall survival was similar, 21.9 months with FOLFIRINOX versus 21.3 months with chemoradiotherapy. Although toxicity profiles differed, severe adverse events were comparable. The key takeaway is that both regimens are viable options, leaving room for individualized treatment planning based on patient factors and tolerance. And in lung oncology, the WU-KONG1B trial explored Sunvozertinib in EGFR exon 20 insertion mutated non-small cell lung cancer. Confirmed response rates were around 46% in both 200 mg and 300 mg daily cohorts. The higher dose offered slightly better CNS activity, but more grade 3 or greater adverse events, suggesting 200 mg may provide the best balance between efficacy and safety. This is, of course, an encouraging option for a difficult-to-treat patient population. And in breast cancer, the updated ASTRO-ASCO SSO Guidelines for post-mastectomy radiation reinforces PMRT for most node-positive patients and select high-risk node-negative patients with tailored volumes, moderate hypofractionation, and advanced planning techniques to optimize outcomes and reduce toxicity. Additionally, a retrospective study on sequential ADC use in metastatic HER2-negative breast cancer found progression-free survival was longer with first ADT administered versus the second, and prior ADC exposure reduced subsequent chemotherapy efficacy. Patients with CNS metastasis had similar outcomes to those without, highlighting the need for careful sequencing of these therapies. And moving on to gynecological oncology. Preclinical data shows sacituzumab govitecan has potent activity against TROP2-positive low-grade serous ovarian cancer, a chemo-resistant subtype, using patient-derived xenograft models. Tumor growth was markedly inhibited and survival improved, suggesting that this ADC could be a promising new option for recurrent treatment-resistant disease. And on the supportive care front, olanzapine 5 mg daily significantly improved anorexia and weight gain in patients with incurable cancer and cachexia, also benefiting quality of life, anxiety, and insomnia, though clinicians should watch for hematologic toxicity. And finally, A pilot trial of brief nurse-delivered, meaning-centered psychotherapy in home-based advanced cancer care showed feasibility, high engagement, and meaningful improvements in psychosocial outcomes. Recruitment, retention, and adherence were excellent, supporting further study of this intervention to enhance patient quality of life. So what is this week's take-home? Whether it's streamlining diagnostics, advancing CAR T therapies, optimizing neoadjuvant regimens, refining radiation strategies, or enhancing supportive care, this week's studies reinforce a central theme. Progress in oncology is increasingly about personalization, matching the right therapy to the right patient at the right time. And that's it for this week's OncoAlert Weekly Roundup. I'm Gil Morgan. As always, stay hopeful, stay informed, and stay OncoAlert. See you next week.